Clomid. This is one drug people abuse every time, and a lot of people have been using this drug without getting any results out of it, and that is because they are abusing it, or they are misusing it, or they are not using it when they are supposed to use it. So in this video I'm going to explain what Clomid is, what it is used for, the right time you can use it to have good results, and when you can't use Clomid. Hello guys, what's up and welcome back. This is Everything Health with Nurse Dara. In this channel we get to discuss different topics related to health. If you're seeing this face for the first time, I am Nurse Chidera Cynthia. I am a registered nurse, registered midwife, registered public health nurse, and BNSC nurse degree holder, currently practicing here in Nigeria. If you're currently trying to conceive and you're using Clomid, or you intend to use Clomid, or you just want to know what Clomid is all about, then this video is for you, and keep watching. Clomid, I call it the ovulation stimulator. So how does Clomid work? What does Clomid do? How does it help in treating infertility? Clomid is actually a drug that helps to increase the levels of these two reproductive hormones, FSH and LH. FSH is follicle stimulating hormone, LH is luteinizing hormone. But these two hormones are responsible for stimulating ovulation. It causes the maturation of eggs and release of eggs into the fallopian tube for fertilization. Now let me bring it down for my viewers who are not in the medical field for easier understanding. Ovulation occurs when an egg is released from the ovaries into the fallopian tubes. And then when intercourse occurs, they swim up to the fallopian tube and fertilize this egg that has been released. Okay, now what causes this ovulation to occur? What makes these eggs to mature and be released? There are two hormones which are the reproductive hormones that are responsible for that. That is the follicle stimulating hormone and the luteinizing hormone. These hormones causes the eggs to grow and mature and be released into the fallopian tube for fertilization. That is when ovulation occurs. So when the levels of these two hormones are low, it means the eggs won't be able to grow and mature, and the eggs won't be able to be released into the fallopian tube for fertilization. That simply means ovulation won't occur. So what does Clomid do in this situation? Clomid simply increases the levels of these two hormones, the follicle stimulating hormone and the luteinizing hormone, causing them to make the eggs to mature and to be released. It helps in stimulating ovulation. Clomid comes in 50 milligrams. You can take 2 tablets, that is 100 milligrams a day, every day for 5 days, depending on what your physician wants. That is why you can't get this drug over the counter and start taking it. It needs to be supervised. It is a prescription only drug. Your physician have to prescribe the drug, monitor you while you're taking these drugs, tell you how to take it, when to increase, when to reduce the dosage, and monitor the side effects. You can't just walk into a pharmacy, get this drug and start taking it unprescribed, because it comes with its own side effects. You need to be monitored. Next question is how to take Clomid. A lot of people will tell you take Clomid from day 5, cycle day 5, you start taking Clomid. That doesn't work for everyone. It's good to start from cycle day 5, but that is for women with 28 days cycle. Women are different. Women have different menstrual cycle lengths. What works for Mrs. A will not work for Mrs. B. So you can't just start taking it at cycle day 5. You have to consider your menstrual cycle length, your ovulation days, your fertile days before you start taking it. Okay? People who take it from cycle day 5 are women with regular 28 menstrual cycle lengths. It is advisable to take it 3 to 5 days before your fertile window starts. Women with 28 days menstrual cycle length usually ovulate on cycle day 14. So 5 days before cycle day 14 is what? Cycle day 10. So they start taking it 5 days before their fertile window starts. That is cycle day 5. Because this drug lasts for 5 days, you take it for 5 days. So they take it from cycle day 5 to cycle day 10. and then 5 days after that their ovulation will occur. So the drug is to be taken 5 days before your fertile window starts. For instance, a woman with 21 days cycle, when she hears that you're supposed to take Clomid at cycle day 5, remember, a woman with 21 days menstrual cycle is likely to ovulate on cycle day 7. So if she starts taking it on cycle day 5, she's going to finish the drug, which is meant to last for 5 days, on cycle day 10. By the time she's done taking the drug, she have already ovulated on cycle day 7. So it's not going to be effective for her. That is why some people take these drugs and they are not getting any results out of the drug, because they are misusing it. So you need to understand your menstrual cycle length, then check 5 days before your fertile window starts, then you start taking it. For a woman with shorter menstrual cycle length, she can start taking it from day 2 of her menstrual cycle length. So you just need to understand your menstrual cycle length and then use it to calculate and know when to start taking this drug. The right time to have intercourse when using Clomid, when you're done with your last dose, okay, that is the 5th dose. You can just start your intercourse. Feel free, explore, okay? Have it every day, every 2 days, but just make sure you're having intercourse, regular intercourse, so that you get a good result. So who are the people who are not supposed to take Clomid? Before you even start taking Clomid, you're supposed to run tests, hormonal assay tests, and be sure that your cause of infertility is actually low levels of FSH and LH. Then you can take Clomid to increase the levels of these two hormones and cause ovulation to occur. So if your cause of infertility is other reasons apart from these low levels of FSH and LH, then you do not really need Clomid. A lot of people abuse this drug. Once they hear infertility, they rush and buy Clomid and start swallowing Clomid. It is not for everyone. You have to find out your cause of infertility first before you can actually start taking Clomid. If it's other reasons like blocked fallopian tubes, you do not need Clomid. Blocked fallopian tubes does not mean you're not ovulating. You're probably ovulating, but the tubes are blocked, so the sperm can't get through to the egg that you've ovulated to fertilize it. So taking Clomid will only cause hyperstimulation of the ovaries, and a lot of eggs are going to be released, and all the eggs will still be stocked in that blocked tube, and the sperm still won't be able to get through the blocked tubes to go and fertilize the egg. So you're not really doing anything. Okay, taking the Clomid drugs will not help you. If you have other reasons like other causes of infertility like fibroids and the rest of them, endometriosis and all of that, you do not need Clomid. Clomid is for women who have ovulation problems, women who are not ovulating, women who have anovulation. They are the ones that are supposed to take Clomid. There are some side effects associated with Clomid. They include headaches, nausea and vomiting, fullness in the abdomen, hot flashes, mood swings, dizziness. If you're having these side effects, they are not necessarily a cause for alarm. It will simply subside once you're done with the drugs. But then a more serious side effect of this drug is what we call hyperstimulation of the ovaries. This can lead to major side effects that might even be life-threatening. Side effects like breathing problems, not being able to breathe properly, which can become a case of emergency. In this situation, the woman will be advised to stop taking the drugs immediately. This drug can also cause release of multiple eggs, which can lead to twins, triplets, quadruplets, quintuplets, and the rest of them, which is actually good news for some women, but it is also a risk pregnancy. Remember that. So some women, when they are trying to conceive with Clomid, they take these drugs, do some scan, abdominal scan, check if multiple eggs are being released that month, and avoid getting pregnant that month to avoid having like 6 babies at once. It is a risk pregnancy, please. There are other drugs that can also be used in place of Clomid. So when your doctor checks and see that the Clomid is not working for you, or you're not responding well to the drug, or there are so many side effects associated to the drug that you're having, or you're experiencing a lot of side effects from the drugs, your doctor can decide to change Clomid and give you something like letrozole. It is also an ovulation stimulation drug, or your doctor can change it to any other drug that also stimulates the ovaries. So when you complain to people about your infertility problems and they tell you to swallow Clomid, please consider the things I've just said in this video. Clomid is not for everyone. You can't just be swallowing Clomid without knowing your cause of infertility. Some people even have the male factor infertility, like their male partners are the ones that actually have problems with their sperm, whether low sperm count or anything, and the women are busy swallowing Clomid. Stop putting yourselves at risk for no reason. You need to consult your physician. They will be the ones to decide whether you should take Clomid or not. If you enjoyed this video, don't forget to click the like button, click the subscribe button, join my little family. If you have a question, leave a comment in the comment section and I'll be there to respond. This is it for this video. See you in my next one. Bye.